Hello, this is Mr. Neil Writer, consultant audiologist and director of Clearwax. Thank you for joining me in another demonstration video of our recently developed Waxscope. The Waxscope is due to be launched early autumn 2022, so if you are interested, please do email info@clearwax.co.uk. So we had a client here who attended with bilateral fully occluding earwax, and we're using, I believe, the 4.25mm speculum to dilate the ear canal. It's open, so they have got quite a narrow entrance. And you can see there, we've just got the wax and dry skin plugs in focus. You can see there's some peripheral dead skin. So we've just got the main body of wax a bit further in focus. And so with the Waxscope, it doesn't utilise binocular vision, which is one method of obtaining depth perception. And that's because, similarly to our eye clearscope, endoscope, we're viewing the image on a 2D screen. However, depth perception is still available with the Waxscope because you're actually essentially using the focus as a means of obtaining depth perception. I often hear it that you're not able to obtain depth perception unless you're using binocular stereoscopic vision, but that's not true. If you watch my procedures with the endoscope, which is a 2D view, we're not using binocular vision. You can get depth perception using monocular cues as well, using shadows, landmarks in the ear. Another feature called motion parallax. So when you're moving the instrument forward and backwards, you can, by the relative speed and change of where you are in the ear, that gives you depth perception. But quite simply with the Waxscope, you get the object in focus, and when you're in focus, you've got your depth. So it's quite straightforward in that respect. So this is a bit more of a stubborn plug of wax. You can see it's a bit darker, it's a bit deeper. Just managed to draw that out, put a bit of oil in there as well. Still got a bit more actually. So at the moment you can see it's not in focus, so we're just going to adjust that. It's now in focus, and for that reason, when the instrument's also in focus, we know we're at the right depth. So as I said, you can obtain depth perception using 2D monocular vision as well. And you can see the eardrum in the distance. So as I said, the entrance of the ear is a bit narrow. There's peripheral skin. I'm just going to leave that. I'm just going to get this bit of wax on the canal wall. So I've just got that in focus. I'm using a fine end suction probe, so as soon as it's in focus, again, we know we're in the right place. This is a bit further in. I'm just angling the speculum. So that's on the anterior canal wall. So we're now going to change focus. You can see the eardrum there. Nice and healthy. Got a good view. And that's the patient's right ear. So is the Waxscope more beneficial than head loops? I suppose you'll have to make that judgment by watching the video. So if you visit our Clearwax YouTube channel, we've got a host of videos already with the Waxscope. And I used head loops many moons ago prior to developing the endoscope, the eye clearscope. And I really struggled with the wax that was deeper in the ear, more medial. Struggled with the focus as well. Struggled with magnification. But as I said, what you're seeing on screen now is actually what you see is what you get. So these videos are exactly what I see on screen. Now, you can't compare the Waxscope to an endoscope. An endoscope, if you watch my other YouTube channel, you'll just see the difference in the view, the field of view. I would say the Waxscope, in terms of the magnification and clarity and zoom, it's actually probably a bit superior than an endoscope. I would put the Waxscope similar to, I've got an ENT microscope at the clinic myself, and it provides a very similar view, from truth be told, in terms of magnification and clarity. So the Waxscope is designed to be the next best thing. If you struggle to use an endoscope, there's a few people do struggle to use an endoscope because of the bilateral integration. So the right hand, left hand work in coordination. So just going to get the eardrum focus. There we are. So again, nice and healthy left ear. And the patient's now to the hearing. So hoping